A stroke can happen to anyone, from infancy to senior citizens. Strokes are devastating at any age, but the number of young and middle-aged adults being diagnosed with them is growing rapidly. And SNN Local News 6 reporter Mia McCormick has more on what the symptoms are and really who's at risk.
Well, the number of people ages 20 to 45 diagnosed with a stroke has jumped from 4 to 7% over the past decade. Risk factors are similar to those of heart disease.
Here's some more corn here.
Carol Brenner loves to work in the garden. At 86 years old, he spends 3 hours a day tending to his plants. Gardening became his passion after a stroke set him back to basics 6 years ago.
Paralyzed on my right side and everything, and I couldn't even nothing, any kind of walking.
Nearly 2 million brain cells die every minute after a stroke. Brenner was lucky. His wife noticed his words were not making sense and called 911 immediately. Brenner relearned how to walk, speak, and even read. But for Bernard Gaines, life did not come back so easily.
Any type of sport has a ball too, I like to do it. And I had to really adjust to knowing I'm not going to be able to do it anymore.
Gaines was at work when he started to feel sick. At 43 years old, a stroke never entered his mind.
You know, I was in good health. I was a great athlete. I played sports at the time, and everything was going fine. I would never guess in a million years.
The number one cause of stroke is high blood pressure. Making sure your family members know the signs can be the difference between life and death.
But the key thing is that there's a sudden loss of brain function, a sudden loss of neurological function.
Getting the right treatment quickly is the most important thing you can do. Sarasota Memorial Hospital houses Southwest Florida's only comprehensive stroke center. There, Dr. Concha uses advanced techniques to reduce the amount of brain damage caused by strokes. Those treatments are what got Gaines back out on the baseball field coaching local teens, and Brenner back into his garden.
You always love to garden?
And I think it's really important, again, to say that the word and acronym FAST can help you remember what stroke symptoms look like. Face numbness or weakness, especially in one side. Arm numbness or weakness. Slurred speech. And time to call 911. The faster that you call, the easier it is to recover from the damage.
Mia, you mentioned all of those brain cells that are affected every minute. Is there a window where doctors can stop that damage from happening?
Doctors usually say there's a 3-hour window in which they can really reduce the damage and save a patient. After that 3-hour window, it becomes much more difficult.
Which makes it all the more important to be watching for those signs.
Right, right.
All right. Thanks, Mia.